Polly Hornberger is often on the go, not just socially, but with her dogs too. For years, though, something put a damper on that lifestyle.
Agility is a sport with your dog, and it's jumps and A-frames, and you're directing your dog. So you are telling them where to go and how many jumps to do, and you're timed. My Sammy is very, very fast, and I just could not do agility because I would have leakage. I raise puppies too, and running after them and collecting them, and any kind of running or laughing, uh, a hysterical laugh or a sneeze. You would have to have a pad on all the time for the incontinence.
Polly was one of the first patients I met over telehealth when we first were kind of converting to that during the pandemic. And Polly was coming to me because she was experiencing frustrating amounts of urinary leakage and difficulty with control, particularly when it came to doing things with her animals, like doing shows. When she was more physically active, she was finding that she was experiencing larger amounts of urine leakage than she had in the past. She expressed that it was impacting her ability to enjoy the things that she enjoys, and that's what we listen for when we're deciding with patients, who needs intervention and who does not, is when it's starting to impact what we commonly call quality of life. The way that she was describing leakage that was occurring from physical activity, we suspected the leakage was occurring from a weakness in her urethra, which is very common. It happens in at least 50% of women at some point in their life, that they'll experience some leakage from a weakness in the urethra that becomes bothersome. And so that's what we suspected. And we did an exam and some brief testing to confirm that that's where the leakage problem was coming from. And then once we knew what we were dealing with, we started talking about treatment options.
I had two issues. I had an overactive bladder, and then I needed a sling put in. So I'm taking a medication for the overactive bladder.
I think slings are one of my favorite surgeries to offer because they offer such a great success rate through minimally invasive surgery and have wonderful long-term outcomes as well. So the slings that we typically use that are the least invasive way to approach this are synthetic, meaning that they are man-made, and they hammock around the urethra to support the urethra at its underside. So kind of like an under the urethra support. If this is kind of the bladder and this is the urethra, they fit right in this area under the urethra, so that when there is pressure from a cough, from a sneeze, from physical activity, there's something there to support the urethra. After the quick procedure or surgery, patients will be sent out to the recovery room. We test everyone's bladder to make sure that it can empty after it's had that procedure. And then most people, at least 90% or more, can urinate that day and go home without any other assistance to empty the bladder. And then you go home and minimal pain. We actually recently did a research study on our patients' pain levels, and they were exceptionally low. And most patients don't require any even prescription pain management for the discomfort they have after the surgery. So, and then we see people back in about 2 weeks and give them the okay that everything looks good and they can start doing most any of their normal activities.
Oh yes, I can do agility now and run around the ring with several dogs, run after little puppies. I have nothing better to say about Dr. Long. They just make you feel, her whole crew in the office just makes you feel so comfortable that you can just talk about anything or say anything. It's just great.
When we see patients back, it's one of my favorite things because they're just delighted, typically that they have had a tremendous change in their control for the better. And they often, I think the most common thing I hear from patients when they come in is, why did I wait? It's one of those aha moments where you just think, boy, this was so simple, and it's made such a big change.
So, I'm telling women, just don't put up with it. Nobody wants to have surgery, but it's very easy. It's really, it's very simple. And I mean, you're in and out the same day, and I could cough or sneeze the next day and I would not be incontinent. I tell everybody, you don't have to put up with that. You don't have to put up with it. And they just don't want to go and be checked out and deal with it. And sometimes it's hard to talk about it, but no, not me. Not when it worked. It just I feel liberated. It just worked.